are two big questions circulating regarding the unfortunate assassination of Mr. Kirk. The first being, did he suffer and was he aware of anything? The second is, could he have been saved if a medical team was right there at the site? Hi, I'm Dr. Messina, and I spent the early part of my career as part of a trauma team at an inner city hospital, a hospital that saw gunshot wounds basically on a daily basis. To answer this first question is relatively simple. If we look at the video, it's clear that he had a major vascular injury to the lower neck area. He flinches, he falls back, and he loses consciousness. The fact that he wasn't expecting to be shot means that he really didn't have a lot of time to comprehend exactly what was going on. He probably did feel that moment of sharp pain, but then he lost consciousness very quickly. So no, I don't think he suffered, and I don't think he was aware of what was going on. The second question is a little more complex. First, we have to take into consideration the weapon that was used. It was a Springfield 30-06, a very popular sniper rifle during World War II and Vietnam. Because it was extremely accurate, and it shot out a .30 caliber bullet that could travel at 2,700 to 3,000 feet per second. Therefore, with the sniper being only 600 feet away, for that weapon, it was a fairly short range. And the fact that his family were avid riflemen and hunters makes me think that that was a fairly well-sighted rifle. When a bullet enters the body, if it enters an area of soft tissue, say the abdomen, the organs slow it down considerably, which causes a lot of internal trauma. But the bullet doesn't deflect that much and often comes out their back. However, when a bullet enters something that might be in a bony cage, it tends to bounce around and fragment, causing a lot of collateral damage. Now, I didn't get to read the coroner's report, so I'm going to give you information just on what I saw in that horrific video. But it looks like the bullet entered somewhere between the collarbone and the lower part of the neck. And the blood loss was massive, which makes me think that this bullet maybe hit the collarbone, started spinning, lacerating major arterial structures in his neck, just from the significant blood loss. That would most likely be the internal carotid, external carotid, or the common carotid artery, all of which are responsible for a significant amount of blood flow to this side of his brain. Somebody mentioned that it could have been the jugular vein. That's possible, but that's just a vein. It would have a lot of blood loss, but he would still have blood flow to the brain from the arterial circulation. So I do think it could have been even a combination of jugular, but from that extensive blood loss and the loss of consciousness, I have to think it was arterial circulation that was damaged. Next, the coroner did report that his cervical spine had been now permanently tilted at an odd angle. The vertebrae encase two very important arteries, the vertebral arteries, which supply blood to the base of the brain, and they're critical arteries. If that cervical spine was damaged like that, in all likelihood, the vertebral artery was also damaged. So let's say we had a medical team right there on the side of the tent, and let's make it even better. Let's say that the physician of that medical team was a vascular surgeon. We have to take into account the chaos. And is that team going to worry that they might be shot next? Then they have to examine the wound, which is not going to be a clean wound. Most likely, it's going to be a lacerated wound. They're going to have to find the ends of these arteries, provided that they weren't macerated, and try to clamp them off, which would cut the blood flow to the brain completely. Plus, in an area of uncontrolled bleeding, it becomes very difficult to actually find the anatomical artery. So, unfortunately, with a major vascular injury like this, I don't think there would be any way of saving him, even if there was a vascular surgeon heading up a team right on the side of that tent.